Hello, and welcome to the vestibular ocular motor screening presentation. So to begin the exam, you will begin with the baseline of symptoms. As you can see at the top, there's a headache, dizziness, nausea, and fogginess. You'll ask the patient to rank 0 to 10 where they fall with these symptoms following an incident, and you will record it in the baseline symptom column. And then you can begin the exam starting with smooth pursuits. Smooth pursuits test the ability to follow a slowly moving target with just their eyes, no head movement. The target will be held 3 feet away. It will move up and down approximately 1.5 feet and left to right. The target moves at a rate of 2 seconds each direction. As a clinician, we're looking for stuttering, nystagmus, and delayed reaction with their eyes to follow the target. As you can see in the video, you'll instruct the patient to follow the target. Now, the target can draw either an X shape or an H shape, as you can see in the video. Going up and down and across, you'll complete 2 repetitions, looking for that stuttering, that nystagmus, or that delayed reaction in the eyes. You'll come back to center, and that completes the test. Following the smooth pursuits test, you will take another symptom assessment for headache, dizziness, nausea, and fogginess, and you will see how that smooth pursuit exam either made the symptoms worse, the same, or didn't change at all. The next exam you'll complete is the saccades, horizontal and vertical exam. This tests the ability of the eyes to move quickly between targets. The targets are the clinician's fingers held either up and down or left and right, 1.5 feet apart. You'll instruct the patient to gaze 30 degrees at both fingers, and for a total of 10 repetitions going back and forth there and back equaling 1. As you can see in the video, the clinician holds horizontally, left to right, 1.5 feet apart, 2 targets, and the patient will look there and back, going as quickly as possible without moving their head. So that's horizontal completed. Now we will go to vertical, 1.5 feet apart. The patient will look between both the targets as quickly as they can with their eyes, 10 total times. As a clinician, you're looking to see if the patient can't hold their head still while they're moving their eyes between the targets, if the symptoms increase, or if they just have a general slow reaction to going back and forth. Following the exam, again, you will do that symptom assessment for headache, dizziness, nausea, and fogginess. Ask them to rank it 0 to 10, and you'll record it. Next, we'll complete near point convergence. This tests the ability to view a near target without double vision. The patient will focus on a target that's arm's length away. They will bring the target towards the tip of their nose, and then they will report when they see 2 distinct images, or the exam will end if the clinician notices outward deviation of one eye. So we'll see this in the exam here. So the X is the target, outstretched arm from the patient. They will slowly bring it in, and then they will report to the clinician if they see double or if the clinician notices an outward deviation of the eye. And at a normal score, if this is greater than or equal to 5 centimeters from the tip of the nose. You complete this a total of 3 repetitions. This is the third one. Once the third one is completed and the measurements are taken, you will do what you've done in the previous exams. You will take another symptom assessment for the headache, dizziness, nausea, and fogginess symptoms. The vestibular ocular reflex, or the VOR exam, tests the ability to stabilize vision as head moves horizontally and vertically. The examiner holds the target 3 feet away from the patient. The patient rotates their head horizontally and vertically 20 degrees at a pace of 180 beats per minute. They go back and forth 10 total times, and that concludes the exam. As you see in the video, you can hear the metronome playing, and the patient is moving the head to the metronome vertically up and down 30 degrees, 10 total times. Now they'll switch horizontally, doing the same thing. Once the test has concluded, there will be a symptom assessment as we've done for the headache, dizziness, nausea, and fogginess, and you'll record it. The final exam is the visual motion sensitivity exam. This tests the visual motion and ability to inhibit vestibular-induced eye movements using vision. The patient holds an outstretched arm and focuses on their thumb. The patient rotates a total of 80 degrees, right to left as one whole unit. This includes the head, eyes, and trunk. They will rotate to the metronome at 50 beats per minute for 5 total repetitions there and back. As you see in the video, you'll start on the right. When you hit a metronome, you'll go to the left. That's one total time. Once the 5 repetitions have been completed, the clinician will take another symptom assessment for headache, dizziness, nausea, and fogginess, and that will conclude the vestibular ocular motor screening for concussions.